This morning, healthcare workers breathing a sigh of relief as planes, delivery trucks, and government agencies deliver the much anticipated vaccine to frontline caregivers across the nation. New York nurse Sandra Lindsay, the very first person in the U.S. to get the shot.
I felt a huge sense of relief and hope, and just that healing is on its way and that we can finally put an end to this pandemic.
Finally, a defense for those on the front lines who are exposed to COVID every day.
Not only did I get a vaccine, but I got a shot of hope.
Dr. Maggie Hagan is an infectious disease specialist in Wichita, Kansas.
I see about 50 people with COVID every single day. I've been an infectious disease specialist for over 30 years, and I have never experienced anything like this.
For the emotionally exhausted,
I can't express the heartache.
This is a moment to exhale.
It is the beginning of something that's going to be very, very positive.
Healthcare workers showing those who are hesitant this is safe.
And I want to be here to serve as an example to say that, this vaccine is safe. I'd rather see you get the vaccine than see you on a breathing machine in the intensive care unit.
But stressing for now, a vaccine does not replace critical safety measures like social distancing, mask wearing, and thoroughly washing your hands.
I just hope that the public doesn't give up on doing what they need to do.
So, guys, we're now at UF Health Center here in Jacksonville, where they're going to give you're going to see it right live on the air. This is Cynthia Gerdick, so I'm going to walk over here. Before you give the shot, Vicki, I just want to ask her, first of all, are you anxious?
No, sir, I'm not.
You're not anxious?
No.
You've been anxious every day working in the COVID ward here?
I've been anxious every day in all the COVID patients we've been caring about, but being a role model and getting my vaccine is important, and that's what I'm doing here this morning.
Okay, I'm going to just stop for a moment, and we're going to put a stopwatch up on this because we want to show it's been incredibly complicated to get this developed, to get it on airplanes, to get it in vehicles, to get it delivered, to have it in the special unit here that keeps it cold. But this is actually seems the quickest part. So we're going to start the stopwatch. Vicki, go ahead.
Okay.
There we go. We stopped the stopwatch, and it reads, guys, it felt like 7 seconds. 6 seconds. There we go. So it's so fast. Did it hurt?
No, sir.
Okay. You in your unit have sadly not only seen COVID patients die, but you've actually told me that you've had some coworkers who have worked here at the hospital who have had loved ones die. Emotionally, what has this been like for you, not only seeing strangers die, but really friends, relatives die?
It's been very, very different than any other year in my career as a nurse leader, 40 plus years. It is draining emotionally, not only for our staff, but for myself.
And so this shot represents?
Hope, and that we are going to decrease this pandemic.
Okay. Great. Thank you so much. I know that you now have to go sit over there for 15 minutes. They'll check for whether there are any kind of after effects. Vicki will continue. One of the things that is so interesting is that they have this vaccine just a short distance away so that they can make sure it maintains the temperature that it needs, so that they bring it from there, they mix it, or they prepare it inside the syringe, and then they deliver it, and it all happens ever so quickly. Guys, these are the shots being heard around the world.
Oh, yeah, well said, Carrie. Now, of course, it's going to be a while before a vaccine is widely available to the general public. Some people are worried about it. Obviously, this has been on a fast track, but as Dr. Fauci always says, the science has not been on a fast track. They've crossed all the T's and dotted all the I's. How about those frontline workers? Was there any hesitation? I saw your patient there. She was ready to go.
Absolutely. Look, there is no hesitation at all. You can see that the people are here. The other direction, there's a long line of people waiting. One of the nurses that I spoke to this morning said, we believe in science. That's what we're all about. So, of course, they believe that this is going to be their protection. And they hope, by showing us on the air, live as this happens, that when it finally reaches the general public, we will have a sense of confidence that we, too, can get these vaccinations without worry.
Yeah. And of course, they'll be back in a few weeks to get their second shot,
right.
But everybody's got to be reminded to wear those masks and keep your distance and wash your hands in the meantime. Carrie, thank you.